Health and kinesiology is right for me because it's just very welcoming. The faculty here really make it feel like a home away from home. My mom went here, and that's kind of how I found out about UNO. And I came on a college visit. I was walking around and I'm like, yep, this is the place for me. The Health and Kinesiology program is a place where, as a student, you can go and you can take classes, but you also have the opportunities to go on outdoor venture center trips, play intramural sports, and then through pre-professional programs, you have opportunities to go to UNMC. There's nice fluidity between UNO and UNMC. I love the opportunities it's allowed me to have. As a health and kinesiology major, you have to walk the walk and talk the talk. In your lab method, you're learning how to give people programs that are tailored specifically to them and their needs. And then your internship applies everything that you've learned into a real-world setting. I plan on getting my Master's of Public Health, either in epidemiology or in physical activity. It can allow me to work in a lot of different settings, whether that's a research setting, I can work for schools. There's a lot of openings depending on what you would like to do.
I'm here all the time. I mean, this is where all my classes are, this is where I work. There's a lot of different things that go on in this building. I really enjoy athletic training from the standpoint of you're not just like, oh, somebody's coming into a doctor's office. You're with the team, you have a closer experience with the players, working hands-on, and just the interpersonal communication with the athletes really is one of my favorite parts about what I'm doing. Athletic training, it is a master's program. It's intensive, and what you're doing is important. You have to have baseline knowledge when you come in, and then you're just getting to master all those skills and really be prepared to go out there and be in the profession. Especially coming from a smaller area and going to a smaller school. Coming here, the program was very personable to me. Very rarely do I feel like I'm sitting in like a lecture. You can sit there and take notes, but if you're not applying that directly or going out and doing that, that's not always really going to stick with you. So getting to take those skills and then go out and repeatedly do them over the semester, it becomes muscle memory. That all just really works really well for me.
Learning health behavior in the college has been really applicable to my job. Instead of wondering why people don't have these skills and this knowledge, I understand that there is background to everyone's story. We went to Mexico last summer. I got to be a graduate assistant for the trip. I was able to learn and be a part of the same things that the students were a part of. It was really neat. I already have a plan for after grad. I am working as the education and outreach manager for Nebraska Family Planning. To be able to already impact my state on that systemic level has been the true gift in this entire work. Not only have I had an amazing experience at UNO, this is my home. This is where I've learned my advocacy. This is where I've learned my activism. And then to have the mentorship and the people who work here, I couldn't get it anywhere else.